Well, hello, and thank you very much for joining us today to discuss a joint project between Shoebox and Briere, a multi-site healthcare organization. Now, this project took place during the months of August to September when Briere began offering Shoebox quick test hearing assessments to all of the new admissions within the geriatric rehabilitation unit. We were doing this to help improve patient care by introducing an objective hearing test as part of a holistic process. Now, there were three main goals. One, to figure out if Shoebox Quick Test was a valid and acceptable way of screening patients with an eye towards improving patient experience and critical outcomes. To produce a clear document about the implementation process within the healthcare industry. And to increase physician and patient awareness about the importance of hearing. Now, to discuss the details of this project, we have three guests with us today. Mitch Cutney, who is the Director of Innovation and Development at Briere. Heidi Sveistrup, who is the CEO and Chief Scientific Officer at the Briere Research Institute, and VP of Research and Academic Affairs. And Blake Daly, who is the Briere Can Health Network Project Lead.
Well, hi, Mitch, and thank you so much again for talking to us about this project. I'm wondering if you can tell us a little bit about Briere as a hospital to help us understand how it fits in and why, in particular, this project was so important to you.
As you know, Briere is all about maximizing quality of life and helping people stay and return home. We deliver a wide variety of services in aging, rehab, primary care, and with nearly 1,000 beds, our doctors, nurses, frontline care workers, they know how important two-way communication is for maximizing health outcomes, and this was really a project around that. At the time that this project started, Stats Canada came out with a report showing that 3/4 of Canadians had hearing loss and didn't know it. And some, 8.5 million Canadians, they had some form of hearing loss. And so this was a report that was kind of an eye opener for Briere, particularly because we just serve so many older adults. And so we know how important it is, the significance of adherence to health advice from their physician, not to mention the fact that, hearing is related to really important, the type of metrics that we count in the healthcare environment, such as falls. We know how important hearing is. And so we wanted to be able to provide a way to quickly test people's hearing at the onset of their care.
Amazing. You know how important all that is to me as an individual and as a physician. And so I'm curious, when you're running this project, what were the specific goals you're looking to show at the end of it?
Yeah, so this project was made possible by the Can Health Network. It's a new network that is supported by the federal government to really help healthcare organizations in Canada work with local health technology companies. And the major metric for that program is procurement. They want to encourage healthcare providers to not only pilot local technology, but also make sure that that technology is used in perpetuity. And so that was one of our major goals for this. But from our end, the major metric that we were looking for is that can we improve patient experience by testing hearing and making sure that we're meeting people where they're at? And is there a type of value proposition for the frontline care workers? And the quantitative outcome that comes from Quick Test did just that. It gave them that quick, very clear sort of, yes, this person has potential hearing issues, therefore we should look at potentially providing a pocket talker, or maybe we want to clean their ears, or nope, their hearing's fine, continue as planned.
Amazing. And those are exactly the right kind of things to look at in terms of what can you do for a person when they're there in your care. Now, the truth is, despite some obvious benefits of dealing with someone's hearing loss, it's sometimes hard to implement a new program at a hospital or any big organization. So tell me a little bit about what kind of barriers you encountered and what you did to navigate them.
Yeah, very fair point. And I would say that for this project, we were hit with exceptional resistance. But it's not because of Shoebox or because there wasn't a will to do this. It was that we were hit with a pandemic. COVID-19 happened, and everything was sort of thrown into tailspin. But interestingly enough, very quickly we realized at Briere, as we were, implementing new COVID-19 measures such as mask mandates, that hearing became ever even more important, because now not only were there potential patients and families that had an existing hearing issue, but now people were wearing masks, and it's even harder to understand what people are saying. It's even harder to hear what your doctor is telling you need to do in order to get better. And so Shoebox was a great catalyst in us being able to respond to a new world order in healthcare here, a new way of how care was going to be delivered, or a new normal, so that we were equipping our frontline workers with a tool that told them right off the bat whether or not they needed to pay more attention to whether or not the patient that they're talking to can hear what they're saying, can follow the care plan that they're putting forward. And so making sure that our patients and care teams were able to have that critical two-way communication was really important.
Amazing. I just love all that you said there, because the mission and vision at Shoebox is to have an impact on people's lives, and so to hear that addressing that at the hospital level is really impacting these patients' care is just great. Thanks for telling us about the project, and we look forward to hearing more.
Thanks.
Well, hi, Heidi. Thank you so much for taking the time to talk to us about your experience at Shoebox. I'm really curious to know what sort of challenges you were facing as an organization, and how specifically did the Shoebox Quick Test project address those issues?
So, as a researcher, we know that undiagnosed hearing loss is a real problem, and it leads to a lot of social and health consequences. Over 90% of older adults have hearing loss, and we primarily work with older adults at Briere. Our clinical team, recognized that untreated hearing loss could preventing our patients from understanding what they're saying, what our clinical team is saying, and also complying with some of the directives that they've been given from our clinical team. And those issues will contribute to negative health outcomes. And so we wanted to use the Shoebox Quick Test to look specifically at our hearing of our patients. With COVID, there's an added disadvantage. We've now got mask mandates, and we also have an increased use of virtual care visits. And so if we have a patient with a hearing loss, and we put a mask in front of our care providers, or we have people on the phone or by video conferencing, that ability to communicate is increasingly challenged.
So when you think about the outcomes of this project, what did you find? And was it surprising to you? Was it the kind of things you were already expecting, or was it really a genuine shock to see the impact of hearing testing on your patients?
So we did some pilot work in our memory program and in our geriatric day hospital, our inpatient hospital program. And some really interesting things came out of that. First, we had over 98% of our patients, 75 patients, had a hearing loss, reduced or very reduced hearing. So that's a little bit higher than what you would expect, but we have a much older population. What's really interesting there is over 50% of them were undiagnosed. So these are patients that we're seeing with undiagnosed, reduced, or very reduced hearing loss. And of those, 35% of them were actually surprised by that diagnosis. So hearing is clearly a problem for our patients. If we're able to help them with their hearing, then we're going to have much better outcomes for social and health consequences.
So when you think about the future, what sort of impact has that had on the best practice at the hospital, and what your physicians are doing, and what are your plans to scale at Briere?
So as you know, the research that we try to do, we always want that to ultimately end up with better patient care. And so this is a perfect example of that. And the immediate effect of using the quick test in our geriatric inpatient was an increase of over 60% of physicians checking ears for wax. We had a significant number of physicians now using a pocket talker while they were speaking with patients. We've had an increase in the number of patients referred to audiology. And what's really interesting is it's not just about the physicians, it's about the whole care team. And so the hearing loss that was identified was shared with the physicians as well as the rest of the care team. And so now the physios, the nurses, the occupational therapists, anybody who's working with the patients are now paying attention to the hearing loss that's identified. So it's really an interdisciplinary team impact that we've had with this care. At Briere, I think, we have a fairly large healthcare provider organization. We have 5 campuses, 2 long-term care, a transitional care facility. We have a rehab and palliative care hospital, as well as a complex continuing care hospital. So we started in one area with our memory program, and we are now expanding into 4 areas for actual implementation of Shoebox: memory, our geriatric day hospital, our specialized services in our complex continuing care hospital, as well as our rehabilitation. But there's a potential for going further into the other campuses. We have 2, like I said, long-term care and our transitional, and these are all people over 65, or the majority. And so if we're able to then impact hearing across our organization, the social and health outcomes are just going to be that much better for all of our patients and residents.
That's an amazing piece of feedback for us, and thank you so much for sharing how this has affected you at your hospital and what your plans are. We're really excited to follow along with you and iteratively improve if we can on investigating and supporting patients' hearing as they go through the hospital process.
Looking forward to working with you. Thanks, Matt.
Hey, Blake, it's great to have you here. Thanks so much for joining us to tell us a little bit about your experience using Shoebox at the hospital. Now, you were the real point person on the deployment of this limited implementation, and so I'd really like to hear how you worked through the whole process with Shoebox from beginning to end.
Yeah, great. So Shoebox was introduced to us at a leadership development day. We saw the technology, really excited a lot of people, and from there we thought, let's do a mini validation and go from there to see if this will work with our population. From there, some doctor champions popped up around the organization saying they would love to pilot this within their units. And we landed on the geriatric rehab unit here at Briere, which is an outpatient unit, so lots of people coming in. So from there, we sat down and met with the team and decided to go and talk about implementation. So we found they were looking for something that was user-friendly, which the Shoebox Quick Test was. And we rolled out an implementation where the unit support worker would provide the Shoebox Quick Test hearing assessment actually right to the patient upon admission. So when the results came in, after 2 minutes working with the patient upon admission, they would mark whether the patient was good, reduced, or very reduced. That would be placed on a piece of paper. That paper would be placed in the physician's mailbox. And at the same time, the unit support worker would have a quick conversation with the patient about their results, just letting them know what that means and identifying any hearing loss that was picked up in the assessment. From there, the physician would be able to decide how they want to proceed with that patient's hearing results. And it really just shone a light on potential hearing loss that may have gone undiagnosed for a while.
Amazing. Now, you obviously did a lot of tests at the hospital. Did that require a lot of resources, and how many units did you have to do this?
Yeah, it was surprisingly less than one would imagine. So we had 2 Shoebox Quick Tests because we had 2 units. And of course, because of COVID, we wanted to keep bubbles in place. So we really primarily used one shoebox for the 6th floor that we were doing this on. And that was able to do tests for all the new admissions. So we would have anywhere between 2 to 4 new admissions a day on each unit. And this allowed us to easily provide the Shoebox quick test to these patients.
So I'm really curious to know how the shoebox test, or I suppose the results, impacted the patient as an individual. But then, did it have any impact on the physicians, or maybe even the hospital as a whole?
Yeah, the Shoebox quick test, with as small of a platform and as simple as it is, really had an impact on all three of those stakeholders. So starting with the patient, for some of them, they had never had their hearing assessed before. And this was the first time that they objectively saw, wow, what I was thinking could have been something. This is validating my experiences. And for some of them, that started their hearing journey with a referral to audiology that was made between a conversation in them and their physician. So really exciting stuff there. For the patients, it also elevated potential wax that was in their ear. So that helped with the physicians, and the physicians being able to objectively assess whether somebody had hearing loss or was experiencing hearing loss or the beginning of hearing loss. So that was great as well for the physician. And then for the overall hospital, our larger goal is that this will improve communication. If we know patients' potential hearing loss, and we know that this patient can't hear the whole care team, then you can imagine that that is impacting their time with us at the organization. So an objective assessment of that is going to go miles in terms of improving how the patient is hearing, rehabilitation, or questions from the physician, or even
Amazing.
assessments that are done. Yeah.
Amazing. So you really might expect that, a hearing test would let people know about their hearing. So that's sort of an expected outcome. It sounds like that worked out. But were there any unexpected outcomes from running this project that you weren't really anticipating?
Yeah, one of the main ones would have been how easy the Shoebox quick test was, not only for us as an organization to set up and get implemented into the workflow, but for the patients. I mean, some of these individuals have never used iPads before, and they were able to go through the entire Shoebox quick test in their first try, get their results, and walk away with a result, an objective hearing screener, in just a couple of minutes. So just how easy it was for patients to use was a game changer in terms of how I think about the Shoebox quick test, and then how easy it was as an organization to kind of implement into the workflow.
Were there any particular patient responses or use cases where the patient had an interesting experience using the device?
Yeah, there was a really touching moment that happened where we worked with one patient, and right when I introduced the Shoebox quick test and asked him to be a part of our pilot, he was overly enthusiastic. And really quickly, I started to learn he had been in the Canadian Air Force, and for every year of his career, he would have hearing assessments done. But it had been 25 years since he had retired, and he hadn't had an assessment done since then. So it brought back some memories for him. It brought back some peace of mind that he was going to have that assessment that he was used to every year. And he just loved it start to finish. He had 25 years of the old way of doing them, and now this was him seeing, the new way of doing hearing screening assessments. And he was just over the moon. Just loved it start to finish. Loved the technology. Loved the headphones. It reminded him of working on the planes, and it was just a really touching moment all around. That was a great patient experience.
Amazing. I love that we can provide that patient experience, particularly for people like our vets that have done so much for us in the past. It's nice to be able to deliver, healthcare in a mobile and convenient way to them like this. So thanks for sharing that. Now, it's not always easy. In fact, it's almost never easy bringing new technology into a hospital, and often requires essentially what happened here, which was a public-private partnership where the hospital, as a publicly funded organization, is working with a company. Sometimes that has its challenges, and sometimes it works out really well. Tell us how it was like working with Shoebox.
Oh, Shoebox was a dream. Like, couldn't picture a better team to be working with. Shoebox is grounded in medical history, like yourself as the founder, Dr. Bromwich, working within the medical field for your whole career. So the team at Shoebox understood our organization and what was happening and the complexities of our specific organization. From there, we had 2 amazing project leads. They were able to, again, understand our problem, but also provide different perspectives that haven't been seen so much in kind of the hearing journey of particularly our departments. So just bringing to the forefront how important hearing is, providing us with the most up-to-date literature on just how huge of an undisclosed issue hearing loss is. And then, of course, project management from day one, access to their whole team, support for setup, support for any issues that we were running through, just really high-touch hands the whole way, and really made us feel confident that we were going down the right path.
Amazing. That really warms my heart to hear, because the whole purpose of developing this new medical technology is what's called translational research, taking it out of the research laboratory and putting it into the real world. And this kind of technology implementation is exactly what I want to see. So thank you so much for taking the time to explain how it worked for you guys.
Absolutely, Matt. Yeah, it was a real pleasure, and it's an honor to be working with you guys and to be on the cutting edge of technology in terms of hearing assessments and addressing this problem that has kind of gone undiagnosed.
Amazing. And for anyone that's watching out there, if you have further questions or would like information about how this project was run or whether we could do it at your location, please contact us at www.shoebox.md. Thanks again.